Anusha has joined us from the Office of Life Science. Anusha, I realise that you're under time pressure, but thank you very much for joining us, and you've got a few thoughts about the Office of Life Science.
Sure. I hope. Thank you for that, Steve. And I just want to check if you can hear me loud and clear before I kick off the presentation.
Yes, we can.
Okay, perfect. So thank you for inviting me to give a quick run through on updates that are relevant to EU exit. And on the second slide, you can see that I will be giving a brief introduction to the Office for Life Sciences and then swiftly moving on to the key actions and further guidance that businesses need to familiarize themselves with. On slide 3, gives the introduction to the Office for Life Sciences. So as most of you will know, the Office for Life Sciences is a joint unit between the Departments of Business, Energy and Industrial Strategy and the Department of Health and Social Care. This puts us in quite a strong position to work as an effective conduit between the government and industry. And one of our key responsibilities is engaging with businesses. So I do hope we've been in touch with many of you joining us at this webinar this morning, or have received frequent updates from us as far as EU exit is concerned. So a large number of you must be thinking, given the situation that we are in now, should we still prepare for a no deal? And the answer to that is yes. And the Prime Minister has repeatedly been clear of his desire to leave the EU on the 31st of October. Steve earlier on briefly referred to the bill that has now become law for the Prime Minister to ask for an extension to the 31st of January. However, at the end of this period, we might still be in a potentially be in a no deal situation. And given the political uncertainty, it is vital for us as a responsible government and as a responsible country and businesses to continue to prepare for all scenarios, including a no deal scenario. And in the next few slides, I'll just be going through quick actions and guidance. But please feel free to email me at the Office for Life Sciences please send your questions to BIA, and then they can funnel those questions to me regarding the presentation I present for you this morning. So, 5 actions to prepare for a no deal. The first action says, please go to gov.uk for information that is relevant to your businesses. The next few slides will cover medical devices regulations in a no deal situation, the regulation of medicines in a no deal, and the continuity of supply. And I'll briefly just run through each of those now. So in a no deal scenario, the UK's participation in the European regulatory network for medical devices would end. And in that case, the MHRA would take on the responsibilities for the UK market that are currently undertaken through the EU system. There are some things that will remain the same. So for a time-limited period, the UK will continue to allow devices to be placed on the UK market. And these devices have to be in conformity with the applicable EU directive. Those products must continue to carry a CE mark, and devices which currently require conformity assessment by a notified body must have a valid CE certificate. The MHRA is taking a very pragmatic approach to this, and therefore there will be no requirements of changes to the labelling of affected products, and the UK will continue to accept labelling in the English language, which includes information from other jurisdictions, such as Ireland. The UK will have a regulatory system in place on exit date, and this will mirror all the key elements contained in the new EU regulations. So these are the things that will remain the same. However, there will be some changes, especially with regards to the manufacturers and the UK responsible person. So manufacturers placing products on the UK market must first register with the MHRA. If a manufacturer is not established in the UK, it must designate a UK responsible person to register and act on its behalf. If you have any questions around what a UK responsible is, so how do you define the person, what are the kind of roles and responsibilities that they have, you can find these on gov.uk. And following that, if you have any specific questions on their roles and responsibilities, please do get in touch. And then the other thing that's going to change with regard to registration of devices is that in a no-deal situation, all devices will need to be registered with the MHRA before being placed on the UK market. As this is an extension of existing requirements, businesses will be given a grace period for compliance. However, this period will differ depending on the class of the device. And again, MHRA's website gives you details of the rough time frame. And if I recall that correctly, it varies from 4 to 12 months depending on the risk category your device falls under. So briefly, I have covered the areas you should familiarize yourself as far as medical devices regulation is concerned. Now I will move on to medicines regulation in a no deal. So most human medicines on the UK market already have a UK marketing authorization, and this will be unaffected by our exit from the EU. Centrally authorized products marketing authorizations will automatically be transferred into the UK marketing authorizations on the day the UK leaves the EU. MHRA has put in place new assessment procedures. These are of 3 types. I will just mention what these are, but again, the details of all these assessment procedures, so the targeted assessment, the accelerated route, and the rolling review, which is a new feature. You can find the details of this on MHRA's website. Again, if you have any questions, do let me know and I will follow up for you. Moving on to continuity of supply, which is the other area you should familiarize yourselves with, and Steve has also alluded to this briefly earlier on. So the program covers 6 supply work streams across the health and social care spectrum. The work stream continues at pace and it covers 6 main areas. So this is medicines, medical devices and clinical consumables, clinical trials, vaccines and countermeasures, blood tissues and organs, and non-clinical goods and services. So it includes things like scrubs, linen, and food. It is important to remember that this program, the Continuity of Supply program, covers the whole of the UK, including our devolved partners. And we have been supporting the Crown dependencies who have their own contingency plans across the priority supply chain. I briefly want to mention the multi-layered approach that was launched on the 26th of June. And this multi-layered approach you can see in the next slide has 6 main pillars. I do not have the time to get into all the details, but so that you know what are the areas that are covered within our multi-layered approach, which is something that we are continuing with as we had in place in March, and we continue to follow this in the run-up to October. These include stockpiling, rerouting, warehousing, regulatory flexibility, the national supply disruption response, and trader readiness. As I appreciate, trader readiness will be an area of major nervousness for most of the companies and others joining us on this webinar this morning. But there is currently a lot of work in place, including a large number of webinars, as well as roadshows that Hmrc and the Border Delivery Group are organizing. We are working very closely with them to ensure that the content is relevant to the life sciences sector. Again, at the end of this webinar, I will be happy to share with you details of these UK-facing as well as EU-facing webinars, which aim to help you be as trader ready as possible for the 31st of October and beyond. So this is a brief run through on what kind of information you should familiarize yourselves with on gov.uk. Moving on to tariffs. So import tariffs. In the event of a no-deal exit, the UK temporary tariff regime will eliminate tariffs across most goods imported into the UK from the EU and rest of the world. For export tariffs, most medical devices and pharmaceuticals and some associated raw materials are covered by the Information Technology Agreement or the Pharmaceutical Tariff Elimination Agreement. Now, these are international tariff elimination agreements at the WTO, which the UK is a part of as part of the EU. Therefore, the EU will not place tariffs on most medicines and devices, but it is important for me to mention that there will be some exceptions. For example, API is not included in the annex to the pharmaceutical tariff elimination agreement. Again, I don't have the opportunity to get into a lot of detail on these, but again, please do get in touch with me, and I will follow up on any detailed specific questions that you may have on these areas. Sorry, just bear with me 1 second. Just 1 second. Hello, can you still hear me?
Yes, we can. Thank you.
Okay, perfect. Then moving on to VAT. So what's changing? We expect EU member states will apply rest of the world rules to the UK for exports and other EU VAT processes. For parcels sent by overseas businesses, the low value consignment relief will be abolished. So now there will be VAT collected from businesses for parcels up to £135. In a no-deal scenario, postponed accounting will be introduced for imports from the EU and rest of the world. On gov.uk, there are 5 main actions that you need to take with regards to VAT. Again, please do visit gov.uk and you will find details on what actions you need to take with regards to VAT. Okay. I mentioned already what are the specifics in terms of the regulations that you need to familiarize yourself with as well as implement if the UK leaves the EU without a deal. This also includes that medical suppliers will need to establish their marketing authorization here. The applicants and qualified persons for pharmacovigilance in the EEA to sell any products there. And also businesses will need UK establishments by the end of 2020 to sell in the UK. So there's quite a bit of information on what steps you need to take in order to be able to place medical products in the EEA as well as in the UK. You can find this information on MHRA's website as well as on gov.uk. Again, any questions with regards to QPs or QPPVs or timelines, do get in touch and I will be happy to direct you or point you out in the right direction and provide you detailed information where that is possible. Moving on to workforce, this will be an area you will be familiar with, but I will just briefly run through it now. So the EU settlement scheme, the EU citizens and families can apply to this scheme to continue living in the UK after the 30th of June 2021. There's the settled status and the pre-settled status. So the settled status requires 5 years of continuous residence in the UK and full rights to remain. The pre-settled status is for people with less than 5 years of continuous residency. The deadline for this is the 31st of December 2020 for EU citizens in the UK if the UK leaves the EU without a deal. Then I will move on to the EU temporary leave to remain. And this is for EU and Swiss nationals who are wishing to enter the UK between the 31st of October 2019 and the start of the new immigration period in 2021. So everyone entering in the interim period. For this, EU citizens can enter the UK without any visa and can stay up to 3 months. This can be extended for 3 years, but then beyond that, it is not extendable. There is a lot more detail on the occupational list, which has recently been expanded. There's also the salary threshold, and there is a call for evidence. So if these are the areas you are interested in, which I suspect a large number of you who employ European and EEA nationals would be interested in, it is definitely something you should familiarize yourselves with and follow up with any questions that you may have. It's important to say that although I have gone through quite a few policy areas, OLS does not lead on quite a few of the policy areas, and workforce immigration and mobility is certainly one of those areas. But we're happy to follow up on any of the questions that you may have with regards to EU citizens in the UK. And I think with that, oh yeah, so the last slide is on further and more detailed information. So in this slide, I have just tried to collate relevant landing pages, which would be most useful for you and your businesses to familiarize yourselves with, and also will be a good starting point to familiarize yourselves with the area, as well as more detailed information. It would be a good idea to register your email addresses with Hmrc. I think it is, and this is because there are constant updates in this area, and we will try and share this with you at the earliest opportunity, but it might be an idea to register your email addresses with them so that you have access to the data. I mean, but the data, the guidance that the government provides. Apologies for that very swift run through of the 5 key actions you must take. Again, as I have said previously, I am happy to follow up on any questions that you may have. And with that, I'll hand it back to Steve. Thank you.
Anusha, thank you very much. I understand the circumstances in which you're doing this and really appreciate you continuing to do this. I think you've done an immense job there of condensing some very complex information into a rapid and easily comprehensible presentation.